You've got cancer. 3 small words that nobody ever wants to hear. Statistically, according to the American Cancer Association, 1 in 2 men and 1 in 3 women will be diagnosed with cancer in their lifetime. Some cancers today are not the death sentences they were many, many years ago, thankfully, but they can still be very, very devastating, not only in health and within the family relationships and dynamics, but also financially. Do you have a cancer plan? Do you have a policy that will specifically pay you for a diagnosis of cancer? For each day you're in hospital, paying you cash? If you need chemo and radiation therapy, paying you cash? If you get hospitalised, paying you cash? If you need to travel somewhere, paying you cash? Because your health insurance pays the doctors and nurses, doesn't pay you. I recently met a nurse who had let her policy go. And I was there with a young agent, and I was training that agent, and that was the only policy she had with that particular company. So I knocked at the door and I said, "Hey, my name's Rob Henson. I'm just curious that you let this policy lapse. I'm wondering if we did anything wrong." And you said no. You said you let it go because you hadn't used it. Well, I'm thinking, that's great. You've not had cancer. I'm glad you haven't used it, because if you'd used it, you'd have been very, very sick. So then I asked the question, has anybody in your family ever been diagnosed or treated with cancer? And you responded, well, my mum and dad both died of cancer. My sister died of cancer, and my brother has got cancer, but I'm okay. And my response to you was, wow, I'm sorry to hear that you've gone through all of this. How is your brother doing? And unfortunately, the brother wasn't doing too well. And that's when I asked what your occupation was, and you said you were a nurse, and I was, wow. Surely you should know better why you would need a cancer policy. Then I put you in the situation of your sister. And I asked you to put yourself in that situation but survive. And let's look at financial penalties of getting cancer. I asked you, how long has she been sick and in hospital? She'd been hospitalised basically for 4 months. So I asked you, how much income would you have lost over 4 months? Then I asked, if your husband took unpaid medical leave to be with you and look after you, how much money would he have lost? That was quite an amount as well, because he was an over-the-road truck driver. So there's no income coming in. But you still have outgoings, don't you? You still have to pay your premium on your insurance. You have to pay your co-pays and your deductibles on your insurance. You have a mortgage to pay. You have rent to pay, maybe. You have other insurances, car insurance, for example, homeowners insurance to pay. You may have a car payment or a credit card payment to pay. You may have travel expenses to pay to suit your treatment with your cancer. You've still got to pay your electric bill, your phone bill, your internet bill, but you can't go to work because you're too sick to go to work. And when I explained all of this to this nurse, she starts to think. And when she gave me the figures, the policy that she had let go would have paid all of those figures, all of those outgoings, and she still would have had $15,000 left over. Give me a call. Find out exactly what a cancer plan will do in the event that you hear those 3 words that nobody wants to hear. You've got cancer. Give me a call. 920-573-1860. Have a great day, folks.